coming up, and it's a good segue to go from the beach to what we're going to talk about now. Thursday is usually the time we set aside for members from the medical community. Today, no exception, as it's the beach season getting here. Time to go towards the pool, or as you just saw the ocean there. Dr. Elizabeth Acquista, surgeon with Hanover Regional Medical Center, here to talk about some of the safety concerns when it comes to water. And right before we were getting into the segment here, we're talking about, it seemed like last year, almost on a weekly basis over the summer in our area, we were talking about drownings. Let's start there. What are some of the things that people need to know, not only at the beach, but as the pool when it comes to something like this?
I think swim lessons start early, so that's important to get the kids swimming early. Supervising your children when you're in and around water, whether it's at the pool or the beach or on a boat. And adults should be out with their friends. Everybody likes to go out and have a good time on the water and be with your friends. And the remarkable thing is actually that drownings are much more quiet than you would think they would be, not as dramatic as we see on TV. It's quiet, it's eerily quiet. So being aware of where everybody you're with is, particularly small children, because that can happen so quickly.
Some of the safety tips to do at the beach and this pool, I mean, it can be as simple as, you mentioned the swim lessons early, but you know, even if your children aren't old enough to swim, you get the floaties, you get the life jackets. I mean, just how imperative is it that we take these precautions?
Absolutely imperative. So personal flotation devices are different for different sports, and it's important to have a good fit. Small children are going to have a different size jacket than me or you, and everybody should have the right jacket for what they're doing.
As a surgeon, obviously you see things that we, as your average citizens, don't see. When it comes to water and the hazards of it, kind of take me through the process. You mentioned it being a very quiet episode. What does that do internally to you?
It's a deprivation of air. So whether it's a drowning or being real careful in our shallows by the intercoastal, not diving into water that you're not confident is deep enough for that, being with folks who are able to get you out of the water quick enough and so you can start breathing again is kind of the key.
I know it seems like it's almost like a public service announcement. Colin will do it, our other meteorologists do it. We're constantly talking about the currents and the rip currents. If you get taken into one, swim parallel with the shore. Along with the safety tips, just the knowledge of where you're at, how important is it for you to know before you go somewhere what to expect water-wise?
I think it's a good idea, and I think one of the remarkable things is it's so easy now. We have a lot of online apps that are talking about current weather, a lot of data that you can get ahead of time to know that the water is safe and that there's a lifeguard present or not. It's important. Children,
adolescents, older adults, who do you see typically falls into the category of people that run a risk when it comes to the summertime play?
In trauma, it's ages 1 to 44 are the most common. So it's the people who are out there, the young ones getting out there and doing things. It's all of us.
Okay. Well, again, we're getting to that season now. The temperature's starting to rise up. We showed you the great look out at the beach. People will be flocking there en masse. If you're going to be out, again, just always pay attention to your surroundings. And again, as we mentioned with the currents, our meteorologists always warn you, when it happens, Colin, the best advice, swim parallel.
Yeah.